If everybody could start putting their name and campus in the chat, that'd be great. For those of you that are here. Wilfred, are you having Zoom issues?
I don't know why my camera does that,
I
but it's
know.
been doing it in all of my classes.
Mm-hmm. Lots of people having Zoom issues this term, including me.
It's kind of it's somebody else is doing it. It's kind of off and on.
Mm-hmm. Yep.
It's me. I've been having issues for the past week.
Yep. I'm just getting everybody in. Okay, if everybody could turn their cameras on, please. I'll be right back. Okay, I think we have most everybody here. How's everybody doing?
Good.
Good. Hey, Peaches, how are you?
I'm good. How are you?
Good, good. I need 4 of you to turn your cameras on.
Okay, I'm just getting settled in. Can you give me like 2 minutes?
Yep, no worries. Yetsaria, can you turn your camera on? Keandra? There you are. Chris, you're always laughing when you come on. It's that Essington group. I don't know what I'm gonna do with you guys. I don't know what I'm gonna do with you guys. You're always having a good time, aren't you? Okay. Let's see, Zaria, I can't really see you. I can see your forehead. Mostly looking at the ceiling. So if you could pull your camera down, that'd be fantastic. Yep. Let's go to mute. Who needs to mute?
Oh, me, sorry.
That's
need-
okay.
1 second, I'm muting right now.
No worries. Got a lot of people with Zoom issues, huh? Jessica, Keandra, Breda.
Ryan did this yesterday for like 10
Yeah,
minutes and then it stopped.
okay. No worries. How's everybody doing today? Please put your name and your campuses in the chat. Appreciate it. So last week was an exam, so we're going to cover content for weeks 4 and 5 this week. Okay, you had I've sent you out week 4 announcement, which was during exam week last week, and then we'll do week 5 today. I have scheduled or am scheduled or I've already met with numerous students with regards to exam 1. So if you want to review your exam, please let me know. I really encourage anybody that scored below the passing mark to schedule a time with me to go through it. It's important to go through it to figure out what concepts you missed and go review some test taking strategies. I think they're really helpful. At least that's what the students tell me. They're super helpful when we go through it. If you haven't already met with me or scheduled something and you would like to, please do. And I'm happy to review anybody's exam that got above passing. I've already met with a couple of students at high 80s, low 90s that wanted to review the few questions that they got wrong.
I have something set up for you today. And do you want me to just stay on Zoom at the class or?
Nope, you'll have to go off because I need to do this this recording has to be converted and then we'll get back on again. I think you're after class, but not till 4, right? Or 5.
5, right, 5. Okay.
Right. So no, go off after class and then come back on.
Okay.
Okay. Let's see what else. Anybody have any questions before we get started? You guys making contact with your groups to do your week 7 project?
I've made contact with 2 of the people in my group. There's still just one that
Okay,
I have not heard anything from yet.
okay.
So
Okay, remember this is a group project. The expectation is everybody participates, okay? So if you're having issues, just reach out, let me know. I'll try and assist however I can, but there's a reason why we do a group a group activity, right? Why do we do a group activity? What's the
Just
importance
see-
of doing a group activity?
Communication.
communication with each other, teamwork.
Teamwork.
Mhm. Equal participation, right? What are your strategies if somebody doesn't communicate back or somebody doesn't pull their share of the project? What do you'll run into this in nursing all the time. What do you do? Anybody? What are you going to do?
What was the question?
The question was, what are you going to do if you have team members that aren't participating? What's,
Oh, well, you'll either speak with them or speak to your supervisor or manager. Go.
okay. 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 I sent you guys study guide 2 last night. Did everybody get it? Okay. Exam 2, definitely is all changed up. So I need to change up the study guide as well. So that's why it took me a little bit extra to get it to you. It's a good representation. The topics and concepts on there are a good representation of what you're expected to know for the exam in week 7. Okay, so next week we have our reviews again. I believe they're Monday, Wednesday, and Friday. So I've already sent you out the schedule for the whole term. So if you guys could look ahead and see if there's a possibility, if you could attend any of those reviews, that would be fantastic. Anybody had a chance to look at the study guide yet? So the study guide for you guys is weeks 4, 5, and 6. So we'll be covering 4 and 5 today, and then next week we'll cover 6. So after today, good part of the information on the study guide should be familiar to you. Okay? Does anybody have any questions? Does anybody know what we're covering today? What are we covering today? Trying to get an idea of preparation.
Palliative care.
Pardon me?
It's a palliative care.
Mm-hmm. Hospice and palliative care. Yep. What else?
Legal and ethical.
Mm-hmm.
Faith.
Faith community. Yep. Yep. And then last week, the content was the care of the patients with anxiety, mood disorders, mental illness, eating disorders, right? And also the care of the patients with substance abuse, whether it's alcohol, drugs.
Right.
Okay. So, let's go back to week 4. Okay, some of our most vulnerable populations are teens who are pregnant. What makes them vulnerable? Why are they selected out as
They're
a
young,
Knowledge. Lack of
Right.
knowledge.
lack of knowledge. A lot of them who are turn it down. A lot of them who are pregnant are like maybe scared to tell their parents or something.
Mhm.
So they try to hide it. So, they're not getting that care that they need for them or the baby.
Okay. What risk factors do they bring with them?
Not being able to finish school.
Okay.
Malnutrition.
Mhm.
They have high risk pregnancies because of their age and their bodies not being prepared.
Mhm. What about living in poverty? Does that play a significant role?
Absolutely.
Okay. Lack of education. Somebody just mentioned that. What is one of the most important things to do regarding education with the teen pregnant mom?
Try to
These
keep
were in
them
your,
in school.
Keep them in
Good.
school,
keep them in school. Why?
because if they don't go to school, they oh, I knew what I was gonna say too.
They're at a higher risk ending up in poverty.
Mhm. What are the benefits of staying in school for them? What happens the more education you have? What are your advantages?
You have more knowledge in more ways, and you
Resiliency.
figure out more resiliency. You figure out more ways to move forward rather than stay stuck.
Yep.
In the rut. As
Yep.
I would say.
Yep. What about the social support, social networks for these gals?
I know now, the schools I went to, they have like daycare. Some of them had daycare for the children. Some of them have something called I'm not really 100% sure, but it was like something called baby bucks where they will get money for the baby and they can go cash it in and get like stuff for their baby. So they provide like resources, help them sign up for like WIC, government assistance, stuff like that.
Mhm. Okay. Okay, good, good. All right. What about living environments? Especially pregnant teens, they're much more susceptible to abuse and trauma, sexual victimization, human trafficking, right? I mean, that's key for them. And so what are some strategies? Let's say you're the community nurse or the school nurse and you're working in a high school and you have a population of pregnant teens. How all are you going to assess them and work with them? What are your
Until they deliver.
interventions? Think of ADPI. What are your interventions for this group besides staying in school? What else are your interventions for this group?
Giving them information of support groups that they could go to.
Okay. Okay. What about
Or
parenting?
pros and cons of not changing versus changing, like the outcomes of,
Right.
progressing.
Prenatal care,
Mhm.
making sure their prenatal care is organized. What about
And,
mental?
oh.
Go ahead, Yolanda.
Like speaking to a nutritionist so they learn what foods to eat that would benefit them and the baby.
Yep. How do pregnant teens think? Are they past oriented, present oriented, future oriented? Are they thinking about their future?
No, they're thinking about the present, the now.
They're very short-sighted.
Very short-sighted, which leads to what? Well, adolescents in general are not forward-thinking.
Right.
So
Bad
that
decisions.
increases their risk for risky behaviors,
Mhm.
right? Sex, drugs.
Impulsiveness.
What did you say?
Impulsiveness,
Yeah.
impulsive behaviors.
Yeah. What about birth control? Are they more or less likely to use birth control? And they're
Yes.
young.
No, they don't use birth control. They don't even think about it. That's how they get in the situation that they're in.
Mm-hmm. Mm-hmm. Very much a lack of knowledge about reproductive health. Haven't even thought about it. Right? High rates of substance abuse, violence, domestic violence, partner violence among this population. Right? A lot of times they're cycling through the poverty. Right? Teens are much more prevalent to experiencing violence actually while they're pregnant. Why do you think that is? What do you think?
They're in such a vulnerable state from everything they're going through.
Yeah. Maybe they don't know any better. Right?
They
What are
stay
some-
quiet. They stay quiet and just listen to the abuser and do what they say,
Mhm.
rather than go out and figure out where can I get help so this doesn't
Yeah.
continue.
They haven't figured that out yet. Exactly. That's why they're considered a very high risk population in our community setting. Huge. What are some primary interventions we could do with adolescents and teens before this happens?
Educate them.
Pardon me?
Educate them.
Yep. Yeah, when I had in school nursing, when I had the high schools, did lots of primary education, right? On safe sex and substance abuse and drugs and nutrition, right?
Some schools have the sexual education courses
Mm-hmm,
and like the parenting courses.
mm-hmm.
I know that when we was going to school, they had the course, and they even went to the extent of getting the little babies that almost look like the real babies.
Yep. And what about the parents? Do we include them? Why do we include them in the education and the teaching that we do with their kids?
To help them support their kids and to help them follow through.
Right. And a lot of times, you know, the parents may need the education as well. Right. A lot of, you know, teens that end up pregnant have have very little support systems at home, or may have very uneducated parents who don't know any better. Would you agree with that? What about some secondary preventions? So now we've established that this is a high risk group. Remember, secondary, early identification, early intervention. What can we do? What's some secondary interventions we can do? What are we screening for?
STDs.
STDs, big, big, big. Yep. What else are we screening for? What about
Abuse.
contraception? Their knowledge about contraception. Right. Remember, you've identified this as a high risk group. You're in the community, you're the public health nurse. You've been asked to go into the local high schools and talk about risk factors for adolescents. And one of them is teen pregnancy. What are you going to do?
Well, if it's there to talk about prevention, can we be clear and honest as to what can happen
Mhm.
if, you know, they have a young or they explore in sexual activities, and then just be open with it. There's STDs, how bad they are, how bad they can get,
Mhm.
you know.
Successful outcomes for teen moms and babies. Right? It's a struggle. What about tertiary interventions? Okay, so we've established they're already pregnant. Now what? Now what are you
Preventing
gonna do?
another one.
Pardon me? Yeah,
Preventing another one and worsening the problem.
right. But what are we gonna do? They're pregnant
Prenatal
now.
care, prenatal vitamins.
Exactly.
Like I said, they already have it. Okay. Yeah, care.
And yeah,
And
care,
the
prenatal
resources.
care.
Prenatal care, prenatal vitamins, prenatal appointments.
And the
issue,
harsh truth of what happens if you don't comply, I guess.
right. What if they live in poverty? What if they're homeless? What if they have issues with transportation? What if they don't have a support system?
Helping them find the resources so they could get help for those situations.
Right.
You know, connecting them with housing or, you know, with SNAP and
Mhm.
transportation. So they could get to their appointments, so they could go food shopping.
Mm-hmm. And then what about post-birth? You've got a new mom, she's 16 and she's got a baby at home. Let's say you're the public health nurse and you're going out to do those, you've been tasked with working with teen mothers and new babies. What do those post visits look like? What are we focused on?
Making sure the baby's reaching their milestones if they are at the appropriate weight per their age.
Mm-hmm.
Making sure
Mental
they're
health of the teen mom,
Yep. Mm-hmm.
living situation.
Mm-hmm. What kinds of things can you observe in the house? What about bonding between the mom and the baby? Key. That's one of the Healthy People 2030 goals.
making sure their mental status is there, that they don't have postpartum depression, that, you know, you
Mhm.
can tell by how they're dressed, how they're acting, how they're talking, what their apartment, what their home looks like.
Mhm.
You know, do they have a lot of dirty dishes in the sink? You know, is the house clean?
Mhm. How are they responding to the baby? Are they responding to the cues? You know, do they respond to the crying and the irritability? What's going on in the house? Is the father there? Is what's the communication like? What's the whole environment like?
Do they have any support? Other, you know,
Mhm. You know, what's their level of knowledge about growth and development? Right? What's their knowledge about Um, are you knowledgeable to recognize signs of symptoms of abuse and neglect? Very common with teen pregnancies. Okay, just with the lack of education, the lack of knowledge. Okay. Next topic, mental illness. Okay, I think it was, let me look, I think it was chapter 48. Care of patients with substance-related issues. Okay, mental disorders. Okay, what kinds of mental illnesses did we address in our readings?
PTSD,
What?
PTSD,
PTSD. What's PTSD?
Post-traumatic disorder.
Yeah. And what is that?
It is a disorder that people who have experienced traumatizing situations, they may replay the situation back in their head. They may
Mhm.
have high stress levels,
Mhm.
nightmares.
Anything could
It's
trigger it.
very, yeah.
Okay. What about OCD? What's OCD?
Obsessive compulsive disorder.
Okay. And what if somebody were to come to your clinic and present with symptoms of OCD, what would that look like? Remember,
Ritual.
clinical judgment here, taking your mental health knowledge and applying it into the setting. So how are you going to
They'd be
determine?
Some of their
anxious.
behaviors might be repetitive, like they might have
Okay.
a ritual, they might be ritualistic about sitting down, about
Mhm.
what do they do before they walk into a room. They might have to hit the doorknob a couple of times before they shut the door. They might compulsively and obsessively wash their hands because they feel like there's germs.
Okay. Good. Anybody want to add to what Danny said?
Sometimes people with OCD, they speak about having intrusive thoughts. Sometimes they experience mania. From my personal experience, that I've
Mhm.
noticed people with OCD have
Okay.
that.
What about GAD? Anybody know what GAD is? Generalized anxiety disorder. How may that client present to you?
If that situation, I guess, makes them anxious, you'll see it then. And others, um, I guess depends the situation they're in, it'll arise.
And there's multiple concerns, right? Over a period of time. They're kind of all over the place about numerous different things, right? That's your generalized anxiety disorder. What about bipolar? What's bipolar?
Is that kind of like a
Bipolar is-
personality?
Pardon me?
They could go from one way of feeling to another in just a matter of moments. They could be happy, excited, and whatever, and go into a deep depression or
Manic.
go into an anger. I mean, it's just
Polarity of moods.
yeah.
Mhm.
They just go from mood to mood in an instant.
What are some important what's the most common medication clients may take with bipolar?
Seroquel.
Lithium. Right? What's lithium? Let's say a
Mood
patient's been,
stabilizer.
pardon me?
That's a
Let's
mood
say-
stabilizer.
Yep. Let's say a patient's been put on lithium for their bipolar. What are you going to be teaching them when you discharge them?
Have to have their blood levels checked.
Okay.
Mhm. Not to
What-
stop it suddenly.
Okay.
Keep
Okay.
Increase water intake.
Good. Because of what?
Is it the sodium? Doesn't it mess with the sodium levels?
It messes with the sodium. Exactly.
Mhm.
So definitely increased hydration, right? They're going to experience some gastric distress. right? Maybe tremors, maybe lack of coordination. Those are the side effects of lithium. Okay. What's bupropion? What's that?
Is that an SSRI?
Antidepressant. It's a serotonin antidepressant.
It's a SSRI, yeah.
Okay. What is that used for?
So selective serotonin,
Anxiety.
depression.
Paranoia.
Serotonin.
Okay. All right. So what would be some primary interventions with these clients with these severe mood disorders? What would be primary? Let's assume they don't have it yet. So we're trying to prevent. So what are we going to do?
Ask questions about their moods or actions to see what
What about-
happens prior.
About teaching stress reduction, teaching coping skills, right? We're trying to prevent something before it happens. Right? How do we identify the high risk groups for these mood disorders? That would be a secondary intervention. How do we identify these groups?
Excuse me, Miss Marvel. I have to step away from the camera for a minute. Someone's at my door.
Sure.
It would be high trauma victims, people that experience trauma in their life.
Yeah.
Their responses when you're assessing.
Mhm. What about kids who might have witnessed a traumatic event? Might they be at risk?
Highly.
Highly. What about a family history of mental illness?
Then you're scared it can occur and
Mm-hmm.
over to the next.
Mm-hmm. What about socioeconomic factors? What about living in poverty, not having a job? Might those all contribute to these problems?
Definitely increase it.
Yeah, there's a lot of people in your community that you're going to be working with that have these mood disorders. Let's say you're working with somebody with an eating disorder. What's that discharge plan going to look like? What kinds of instructions and strategies are you going to send them home with?
Writing out when they get hungry, how often, or what they eat, or what they prefer to eat.
Mm-hmm.
Not make it kind of forceful, so it's not.
Support systems.
All right.
These are all the different kinds of patients you're going to be working with in the community. Okay. Let's talk about, it was in week 4. Let's talk about the LGBT population. Okay. Why is it so difficult for healthcare workers, some healthcare workers, to care for LGBT clients?
Because their own
They can't
personal
relate to
feelings.
them?
And
Say that again?
Go ahead, you got it. That was better.
No, go ahead.
Relatability.
They probably have issues when it comes down to talking about their, sexual orientation, because you might have a female who presents herself as a male or vice versa. So that may be something that they have issues with.
Mhm. What about your own beliefs? Does that play into it?
Yes, ma'am.
Of course it does. Right. So you have to be able to evaluate your own thoughts and beliefs and attitudes with this population to see if you are able to effectively care for this population. Right? I mean, we as nurses have the responsibility of providing culturally competent care, right? And that includes the LGBT community, correct? Right? We may feel feel some discomfort. However, we have to do our best to overcome whatever personal barriers we have. If you're not able to care for LGBT client, what do you do? I mean, if you just can't do it, what's your responsibility? You
Well,
abandon
I
the
would say,
patient?
You need to talk to your case manager or your boss and let them know that you're uncomfortable, is it
Mhm.
someone else that can take that case?
Exactly,
yeah.
exactly.
So we had a discussion in class, maybe in a different class, and we were talking about like things that you're going to be uncomfortable with while being a nurse. And I'm saying, I'm bringing this up because can you do that? Like, can you be like, oh, I don't want to, I'm uncomfortable with this patient because of such and such? Or is it like, like you still have to care for them, right?
Well,
Because in long-term care, I mean, I get residents all the time that I'm uncomfortable with, but I can't be like, oh, because of this and this and that, I don't want to take care of them. I still have an obligation to them.
that's the general rule. But just with any vulnerable population, here's an example. In my second term teaching, I had a student whose sister was the nurse at the local prison. Okay. One of the inmates at the prison was in there for murder. He had murdered the nurse's sister. Now what?
Well,
There
that's
has
like
to be a
conflict
conflict of
for the
interest.
interest. That's what I'm saying. Like,
Yeah.
that's a conflict. That's different. But I'm just saying, like, if you just basically say, oh, because this person, like I am completely against the LGBT, or, I don't like this and I don't like that, I don't want to take care of them, or this man and this man is together, or whatever. You can't, because like, you're going to come through and face things that you're uncomfortable with. But you can't, when you're vowing to take care of somebody, you can't just say, oh, because of this, I don't want to take care of you. Like, I don't feel like that's a valid reason for you not to want to take care of somebody.
I agree.
There are situations that come up like that though, and if they are truly that uncomfortable that they are not going to make the proper judgment because of their personal issues, they should request another assignment because they're
And
not
to
going to get
take
proper care.
and to take that one step further, then you have to assess what that individual, what's going on. Does that make sense? That's not done with the patient in mind. That's, let's get somebody else to take care of that patient for now, but then let's assess with that individual the roadblocks that we have here and how do we help that individual move forward, because our obligation as nurses
Right.
is to provide culturally competent care.
Right. They
Does
need to
everybody
get
agree
help
with
to,
that?
yeah, they need to get the help to move past that so they can
Exactly.
take care of the
Right.
And considering all the different cultures we take care of now, we have to establish our own, or be able to be mindful of our own feelings and our own judgments and our own bigotry, if you will, to be able to take care of not just LGBTQ patients, but other kinds of high-risk populations. Right? So one other thing about the LGBTQ, CDC recommends that they have annual screenings for the prevention of STDs. What are those annual screenings? What would you think they would be? HIV, right? Syphilis,
Gonorrhea,
gonorrhea,
chlamydia.
Hepatitis.
not chlamydia. Okay, that's one that's not.
Trick.
Nor
Tuberculosis.
is herpes. Chlamydia and
Tuberculosis.
herpes are,
Trichomoniasis.
pardon me?
Trichomoniasis.
So the CDC recommends annual screening for HIV, syphilis, gonorrhea, and chlamydia. I'm sorry, not the herpes.
What
Those are the
population
4.
again? I'm sorry.
HIV, syphilis, gonorrhea, and chlamydia. Those are the 4 annual screenings that the CDC recommends for this population. There is not a herpes screening. Okay?
So TB wouldn't fit into that category?
Mm-mm. Nope. Nope. Okay, mental illness. I think we talked, okay, let's talk about substance abuse. What kinds of substances are commonly abused?
Alcohol,
Alcohol,
Alcohol. What else?
Drugs,
prescribed
Drugs.
medications.
pain pills.
That falls under the category of cocaine, amphetamines, methamphetamines.
Mm-hmm.
What about tobacco?
that too.
Yes.
What about e-cigarettes?
Yes.
Mm-hmm. Vaping.
Vaping? Okay, what about,
Medications for learning disabilities also.
Yep.
They abuse those.
A lot of people who are like gunshot victims. I've known that I personally know I noticed that, once they're on like medication like Percocets and stuff, it's hard for them to get off it.
Mhm. Absolutely. What kinds of what kinds of health issues does substance abuse contribute to? Maybe teen pregnancy. We've already talked about that.
High blood pressure.
High blood pressure. What about communicable diseases, STDs?
Yep.
What about teen pregnancy?
Yep.
Big one is violence. What about domestic violence with substance abuse? Human trafficking. And then the other types of violence, the homicide and suicide. Right?
Mhm.
Let's see, alcoholism. What do we want to know about alcoholism? What kinds of effects is alcoholism going to have on your body?
It can cause it can alter your magnesium levels,
Mhm.
iron,
The liver.
Vitamin B is a big one. Alteration of vitamin B. Low potassium. We talked about iron. What about nutrition issues with alcoholism? What are the nutrition issues?
They don't eat. They drink,
Right.
and don't eat.
Mhm.
I've seen that.
Yep, they rather drink and eat. And
Yeah.
I can speak on it from personal experience because my daddy, my father, he is an alcoholic. So and I just, he lives with me, so just monitoring him, I know his differences. He rather not take his medications because I
Mhm.
have to, kind of get on him. You need to take your medicines. You rather take a drink and take your medicines. That's not going to work.
Yeah, and they don't go to doctor's appointments either when there's something wrong.
Can it also result in iron deficiency anemia, alcoholism?
Yep. Yep. So when you're determining blood alcohol levels, what kind of factors do we consider when considering when trying to determine blood alcohol levels? Does it matter how much the person weighs? When the last time they ate?
Yes.
What
Yes.
contributes to that? The rate of drinking? The rate of absorption? Right? And then we have a couple of statistics of what the liver can metabolize. Okay, the liver can metabolize about 0.25 ounces of, say, whiskey, 4 ounces of wine, and this is per hour, 12 ounces of beer. That's what the liver can metabolize. What are some early signs of alcohol withdrawal?
Tremors.
Mm-hmm.
What else?
Mood
Well,
swings,
there's
mood
one big one.
changes.
Irritability. Mood changes, irritability. Okay? So when you're encouraging somebody to go get treatment or you're assisting them finding treatment, how would you motivate them to go to treatment? What kinds of benefits are they going to get from treatment? That's the very first thing, because they're trying to do this from within. Are they going to try and gain some self-confidence, some self-discipline,
Yes.
right? Self-esteem, right? What about tobacco? What is tobacco associated with as far as long-term issues?
Lung disease.
Lung disease, heart disease, respiratory disease, cancer. What about
Asthma.
secondhand smoke?
Well, that's respiratory.
Let's say you're working with a family that of kids that have asthma, and it's a smoking household, and you're sent out to work with the family, right? What are you going to do? How are you going to try and convert this house to a non-smoking house?
Give them pamphlets and information of cessation, and if they need help, where they could go to get help for that.
Excellent, excellent. Yep. What are you going to educate them about?
The effects that can happen with not just them, but secondhand smoking.
Especially with kids with asthma.
Mhm.
Right? What if they say to you, or let me take a step back. What about moms who are pregnant who smoke? What are some potential outcomes for that?
Low birth weight.
Birth weight.
Mm-hmm. SIDS?
Yeah.
Right? Premature? Those are all risks. What if the mom says to you, you know what, don't worry about it. I'm using e-cigarettes now, I'm vaping now. Is that still a problem?
Yeah, it's just as bad.
Yeah, why is it still a problem? Just as bad. Maybe what you want to hear the mom say is, I'm smoking outside now. Okay. Now, great, but it's better, right? I'm not smoking in the car anymore with the kids. Great. Smoking less. Great. But if they say I'm vaping now, don't worry about it. They're going to require more education, right?
Right.
Okay. What's the biggest danger with e-cigarettes with kids? This came from your readings.
They get burnt,
The what?
burning.
Burning of what? Oh, getting burnt.
Burn. Sorry, yeah. I can't say
Okay.
that.
What is part of the e-cigarette that is so dangerous to children?
That battery part thing. Like,
That is a risk to children. It's the oil. Peaches is shaking her head, right? It's the oil. The oil is poisonous. Important to remember. Okay. So let's assume you're working with a client that is using cocaine, amphetamines, methamphetamines. How might they present to you? How are you going to figure out what's going on? What are their, in your assessment phase, what are they going to present with?
a high blood pressure, heart rate may be high, the temperature may be high.
And is this an emergency situation?
Yes,
Can become, yeah.
Absolutely. What about kind of frantic speech? Excited speech, rapid speech?
Oh, that's what's that called?
Okay, you have to be able to physically assess what's going on with your vital signs and then try and figure out what's the issue. Is this some kind of are we leaning towards an overdose? I mean, look what's going on in this country with fentanyl.
Pressured speech. I remembered.
Pressured?
Pressured speech is the fast speaking and the right.
Oh, yeah. Frantic
Yes,
speaking,
frantic
excited speaking. Yes, yes. Okay. So let's move into, I want to move into, let me make sure I covered everything. Nicotine, vaping, alcohol we talked about. Okay. Let's update those notes. Okay, let's talk about hospice and palliative care. What's the role of the hospice? What's hospice nursing? What's palliative care?
Palliative care actually has like 5 stages to it, and I didn't know that until recently. It doesn't necessarily have to be related to death. That's like the 5th stage. So it could be about the comfort of the patient, the management of the disease, or the symptoms as a result of the disease.
Did everybody hear what Danny said? Key, the stages of palliative care. As a hospice nurse, anybody ever worked in hospice?
I work in hospice.
Okay.
I have.
What are the goals for hospice
That
nursing?
motherfucker don't move.
The goals for hospice is to improve the quality of life for the patient when they're in their end stages of life.
Okay. Trying to alleviate their suffering. Trying to
Just
give them.
provide the most comfortable care as possible.
What about pain management? How important is that?
Very important. That's like priority.
Right.
Okay. So what if you have a hospice patient that is not comfortable? Okay, that whatever's been ordered for them is not working. Okay. When we call the doc to talk about this, do we worry about more medication may lead to addiction?
No,
Why?
because they're already in, I mean, they're on hospice care. So that means they're in the
They're
life
in the end
care.
stage.
So
Yeah.
the purpose
comfort.
is to do whatever you have to do to get this patient comfortable,
Okay.
not in pain.
All right. So let's play that forward to another scenario. That's exactly right. That's what the patient deserves. What if the family members don't agree?
I've
What?
seen cases like that.
Right. You're the hospice nurse, you're in the home. Family members don't agree on the end of life care that's being given. What do you do?
You can, I mean, pretty much education.
I was just
provide
gonna say
education.
education.
I know that one of the biggest issues that I've seen is like a part of the hospice care pack. You know, you have the Roxanol. And when everybody hear, you know, morphine or Roxanol, they just automatically it's going to kill them, you know. But you have to educate them on exactly what the drug does, so they can have a better understanding. Because most of the time they just going on what they were told, or you know, somebody else family may experienced it.
Or they don't want their family member to die yet. They're just not ready for
Right.
it yet. Right?
They're in denial.
Right.
They
Exactly.
won't accept it.
That's where I'm going, is the stages of grief,
Yeah.
right? You have to be very mindful when working with the families and what stages of grief they're in. What are the 5 stages of grief?
Denial, anger,
Accept-
bargaining, depression, and acceptance.
And so every family member, including the client, might be in a different stage of grief. Right? And so I want you to be able to recognize if a family member makes a comment or asks you a question, what stage of grief that might be. Okay? So have an understanding of those 5 stages of grief as it relates to hospice care. Okay?
I have a question on that.
Yeah.
So does it even matter what they're saying unless they're legally allowed to decide about their care? Wouldn't it just be our position to care for the patient, even if the family doesn't agree?
That's a interesting question, but it also depends on, is there a advance directive? Is there a durable power of attorney? I mean, that's where the education comes in. If the family's chosen hospice care, then there's a certain expectation that goes with hospice care.
Yeah, so if there's no advance directive, they have no one picked out to be their
Mhm.
voice.
Mhm.
Wouldn't it just be our obligation to care for that patient, not worry about what the family's opinions
No,
are?
the family
Because
does
no one
need to
put it.
go ahead. Who is
No
going to
one was
jump?
put to make those decisions for them. So wouldn't it just be on us to make those decisions?
No,
Well,
that's when the doctor gets
yeah.
involved. So the doctor educates the family in a group kind of so they could understand and make decisions prior to getting to that part, which is sometimes happens before a physician gets involved.
You
Education.
you always want to involve the family to the best of your ability. But we have to remember what hospice nursing is, right? End of life, quality of care, comfort care. Does that help, Alyssa? I don't know that there's
Yeah.
a black and white answer to that. I mean, it's an interdisciplinary team approach.
Yeah, because I'm just thinking if they're making the patient uncomfortable because of their thought process on it and they're not understanding what's going to make them more comfortable, are we still going to listen to them or are we going to worry about how the patient is doing?
Well, that's a discussion the group has to have, and that's where the physician comes in. The physician has got to, if there's conflict, the physician has got to be the facilitator, because technically the hospice nurse is working is, her scope of practice is also under the care of the physician. So these are difficult situations, no question.
And sometimes it ends up having the state having to get involved because it all depends about the care of the patient also.
Mhm.
We're
having the patient get an advocate.
It becomes a legal situation.
And we do see those occasionally play out in the media, right? Where a family wants to do something different than the hospital wants to do or the doctor wants to do. I mean, that's where, hospice care comes with lots of ethical issues. And so we work on those, as they present to us and try and come up with the best solution for everybody. Okay. Hospice nurses have a very difficult role, not only caring for the family member, client, but they're also caring for the whole family. What if you have family members that don't want to be involved? They can't deal with it. They're just distant and not present. Well, part of the overall goal for hospice nursing is to have the whole family involved. So that hospice nurse has to be reaching out to maybe disengaged family members. Hey, what's going on? And, maybe they've had recent trauma in their life. But the goal is to bring everybody together. Okay. Coroners, do you guys know which deaths are coroners obligated to investigate? This was in your
Unex-
reading.
Anything that's not
unexpected
natural.
deaths.
Yeah.
Yeah, unnatural deaths.
Okay. Where the cause is in question. Also, anybody who's not under the care of a health provider, primary health provider. That's another one. Any
Is
kind
it-
of suspected suicide.
I was about to ask, would like suicide be
Suicide. Yep. And the last one is any kind of a death from an injury. Those are the reasons a coroner would be requested to provide, to do an investigation. Okay. So that's a brief summary of hospice nursing. What's faith community nursing? What's a faith community nurse?
Is it religious?
Anybody know
Maintain
what
the
faith
patients? No.
pardon me?
No.
Isn't it
Is it to maintain the patient's religious,
isn't it a community thing?
So you have an occupational health nurse, a school nurse, a hospice nurse, a home health nurse. There's also a nurse called the faith community nurse. This is a nurse that works with the faith community, whatever the religion is, whether she may work in a church, he or she may work in a mosque, he or she may work in a temple. It's whatever the religion is and wherever it is practiced. Okay, so that's the overall picture, faith community nurse. Okay, and the faith community nurse works alongside just like the nurse in the community. The difference, it uses the ADPI, uses all the scope of practice, but the difference is they add the spiritual aspect of that religion to the care. Okay, taking into account the religion's values, beliefs, practices, whether it's holistic care or preventative care. Okay, and there's a difference between religiosity and spirituality. And you need to understand the difference between those two. Religiosity is basically we all belong to the same congregation and we practice the same religion. Okay, so religiosity is about a single religion that you practice with your group. Where spirituality is more your individual thinking of the higher powers, whatever that may look like. Maybe all of our definitions of spirituality look different. But that's the difference. Religiosity is defined as a specific religion. You practice together, that's your community group. Spirituality is how you think about the bigger picture. Okay? There's also two kinds of faith community nursing models that are practiced. Okay, one is called the congregational model, and the other is called, hopefully you read this in your readings, the other is called the institutional model. Can somebody tell me the difference between the two of them? Jessica, can you turn your camera on, please? Jessica, you there?
I'll text her to see what's going on.
Thanks. Okay, so in your congregational model, the nurse, he or she, is working within the congregation. Okay, directly with those clients. For maybe it's new parent home visits, checking in on lactation, checking in on birth weight, checking in on growth and development. Maybe it's providing grief support groups to congregation members who have lost a family member or have a loss. Maybe it's a health fair for your community members. Maybe it's visiting for supportive care, end of life care. It's confined to within your congregation. That's your congregational model. Where institutional model is when you partner up with the community to provide additional services for your congregation. For example, Meals on Wheels, transportation services, an urgent care, a long-term facility. All right, so the institution, so you're partnering up to provide additional resources. This happens a lot in the bigger congregations where the congregation decides they want to be more of a full service provider with getting clients back and forth to appointments, making sure they have meals, making sure they have exercise days, rec days, who knows, making sure that this is the urgent care they go to. Okay, so they're partnering up with the community to provide additional resources. Okay? So those are the two differences in the models. So, anybody have any questions about that?
I spoke to Jess. She said she's having trouble with her Zoom. She said everything is frozen at the moment, but she's
Okay.
on and she can hear you.
Okay, great. Thank you very much.
No problem.
Okay, let's talk about ethics. What's the first step in decision making for ethics? What do we have to figure out first in your assessment phase? What's the issue?
Issues.
Right? What is the issue? Okay. Ethics committees are in all the healthcare facilities. What's the purpose of an ethics committee? Okay, you're gonna have to look that up. That's going to be on your study guide. All right, you need to look up what the primary responsibilities of an ethics committee are.
It says the purpose of an ethics committee includes processing ethical dilemmas, providing education, and providing policy recommendations and case consultations.
Yep, that's right from the study guide. So somebody's reading their study guide. Excellent. All right, you are going to get asked about ethical committees and their purpose. So you need to know that. Okay, you also need to study. I'm going to move along quickly here because we still have the quiz to do. I need you to review the ethical principles. Okay, beneficence, autonomy, non-malfeasance. Beneficence, remember, do good. Non-malfeasance, do no harm. Be able to identify an example. If you were in the hospital taking care of a patient, what is an example of beneficence or non-malfeasance? Do no good, do no harm. Okay, and also your ethical theories you need to be familiar with. Okay, your principalism, deontology. Okay, so have a look at your ethics. Have a look at your ethics chapter or reading. Okay. Cultural competence, we'll talk about next week, and education, we'll talk about next week. Okay. Questions about all this content? Next week, we'll do occupational health, environmental health, and then barriers to education. That'll be our week 6. So does anybody have any questions about the content covered for today? Helpful information? Covered a lot. This is all part of community nursing. Okay, everybody pull up your quiz 1 or quiz 3, sorry.
Oh, uh-oh.
Pull up your quiz 3 from this week.
Hold on. I got to. Oop.
Okay, everybody have it up? Okay, let's go through this. So this is taking
My
our,
computer's slow.
Okay, this is
Is that up
taking
yet?
our knowledge from last week and this week and putting it into clinical judgment. Practicing clinical judgment.
The school nurse is engaging in a primary prevention program. Which intervention is appropriate? A, provide a list of clinics that provide confidential pregnancy testing. B, discuss where and how to obtain ongoing contraception. C, educate on the side effects of antibiotics for gonorrhea. Or D, create a pamphlet describing an appropriate prenatal diet. What say you?
What's primary? Which one's primary?
Preventative.
Prevention. So
So
what's-
what, B?
Anybody else agree that B is the right answer?
I agree. I feel like the other two choices, they're like after the fact, or you're teaching them, and that's like tertiary. That's not really preventing it.
Okay, so what's A? Primary, secondary, tertiary.
Because I mean, it would be like
That's a tough one.
secondary screening,
Yeah.
Yep. What about C? What's C?
Tertiary.
tertiary.
Why?
Tertiary for sure, because she already got the disease.
Exactly.
Antibiotics.
And so would D be tertiary too, because you're already pregnant.
Perfect. Awesome. Everybody got that right. So B's the right answer.
Number 2, which counseling is appropriate to provide to a pregnant adolescent? A, continue using condoms with every sexual contact to prevent STDs during pregnancy. B, maintain a usual diet without modification. C, prenatal care can be established in the second trimester. Or D, adoption decisions must be made as early as possible.
So what's counseling is most appropriate?
I would feel like the prenatal care because one, you're not going to do the first choice because she's already pregnant. You can't undo that. 2, you cannot maintain the same diet without modifications because it will be custom to her and her pregnancy. And then adoption is kind of insensitive because just because she's a pregnant adolescent, you're not going to tell her to give up her baby.
Wouldn't it be A?
But that's
'cause you
second
wanna
trimester
start
though.
in
You
second
wanna,
trimester. You want
yeah,
to start
'cause-
immediately. So it would
Yeah.
be A because you're teaching them something,
But she's pregnant already.
but she can still get STDs.
Mm-hmm.
But they're trying to
Yeah.
prevent her from getting STDs.
During her pregnancy.
Right.
Oh, yeah.
Because that can cause a whole other set of issues.
Mm-hmm.
Yep. So prenatal care can be established in the second trimester. The reason why that's incorrect, like you just said, is we want to establish
Too late in the-
prenatal care ASAP,
Mm-hmm.
right?
Yeah.
So
I
does
can see
everybody
that.
agree that A is the right answer?
Agree.
Yes.
Okay, good. Okay, number 3.
Which intervention should be prioritized for a child who has witnessed a violent crime?
Mm.
A, teach stress reduction techniques to child and parents. B, assess for family history of post-traumatic stress disorder. C, obtain referral for mental health counseling and services. Or D, observe for emotional or behavioral developmental issue.
I'm going to go with, I don't know, either like
This is a
C or
tough
D.
one.
I would say C,
Why?
I'm thinking C.
because it's priority. Like you immediately want to get them counseling. And then while in counseling, they could probably establish if PTSD is a family, if there's
Mhm.
familial history.
Mm-hmm.
With
Excellent
interventions,
thinking.
aren't you trying to already implement something though with interventions?
Well, let's think about the question. We know that we have a kid who's witnessed a violent crime. What is the priority right now?
Counseling.
How they're
Counseling.
feeling.
Counseling would affect
Counseling.
their
It will be
health.
C, obtain referral for mental health and counseling services.
Correct, because if you do C, you can
It'll
do
answer the other
A, B, and
questions.
D after that,
Mhm.
Right.
right?
Yep.
Mhm.
But the most important thing is to establish or at least start a referral.
Celebration.
To the hotel.
Do you guys agree with that? Do you agree that C
Agree.
is the right answer?
Yes.
Anybody not agree? Okay, number 4.
Which nursing intervention reflects secondary prevention for mental health? A, screening for depression and anxiety at each encounter. B, teaching stress reduction techniques to your young child. Three, observing for side effects from antidepressant medications, or D, arranging a support group for veterans with PTSD.
A,
A,
I would say A.
Why is it A?
because it's
Screening.
screening.
Okay. What's B?
That would be treatment.
Tertiary.
Tertiary.
How is B tertiary?
Because it's a teaching stress reduction. That's teaching a stress reduction to isn't it to a child that already has?
Oh, you said secondary prevention.
Oh.
Oh, the answers being the question.
Nobody has a diagnosis yet.
Right. So we're
So what's
still in the
B?
prevention stage. That's
So it would be teaching stress well, no.
Number 4?
Well, how are
No,
you getting
B.
that? I don't understand.
because we don't know whether or not they have depression or anxiety yet. We have to find
Correct.
out. Everything else
Okay.
speaks to them being diagnosed.
Okay.
think.
Correct. So
Okay.
B would be primary, right?
Mm-hmm.
Mm-hmm.
But the question says secondary.
No, I know. You're right. A is correct. I'm just asking
Oh,
what each of the other ones
okay.
are.
I was lost for a second. I didn't
That's
know
what
where you
I
were
was-
going with that.
Sorry. So
Okay.
B is primary. What's C?
Screening.
Tertiary. It's tertiary.
Why is it
Tertiary.
Tertiary.
Because you're
Observing.
monitoring now. You're trying to see how, okay, now they have it.
Oh, for side effects. Okay.
Mhm. So they already have a diagnosis.
Mhm.
And what about D? What's D?
Tertiary too.
That's tertiary.
That's also tertiary
Why?
because they
Because-
have the diagnosis and now we're putting them in this support group
In a
with
support
like-minded
group.
people.
Good. Excellent. Excellent. Okay, number 5. Ah,
Which nursing assessment is most important in clients abusing oxycodone?
what's the important word in that question?
Most
Most.
important. A, drowsiness, B,
Apnea.
confusion, C, apnea, or D,
Apnea.
itching. Absolutely, because of ABCs. I would go with
Mhm.
apnea.
I say apnea. Yeah, I agree with apnea.
And what's
Airway.
what's a critical symptom of somebody
Respiratory
abusing?
depression.
Exactly.
Mm-hmm.
Respiratory depression. Okay. So
to
yes, they
remind
may
myself
have
to use
drowsiness,
respiratory.
confusion, and itching, but if they're apneic, okay, number 6.
Which reflects tertiary prevention and substance abuse? A, screening for patterns that indicate dysfunction in daily life. B, providing children with information regarding substance abuse. C, arranging addict-led support groups to promote recovery. Or D, helping parents
Excuse me.
role model adaptive coping mechanisms.
What's tertiary?
It's not
would
screening, so we
be-
can
it would
eliminate
be
A.
Mm-hmm.
C.
I'm thinking either C or D, but I'm leaning more towards C
Why?
Because
because
you're
it's
arranging.
yeah, you're arranging to promote recovery for something that's
No.
already been
I feel
Oh,
like
wait
it
a minute.
says in the question it says substance abuse. So I was kind of leaning
It
towards
does say substance
B
abuse.
because it says providing children with information regarding substance abuse.
Oh,
No,
okay.
tertiary
That sounds
is
more primary though.
but tertiary is the person already has it, so we're trying to
have the
find something
problem.
to manage it.
Right.
Right.
So it
That's
will
why
be
I was
either C
thinking
or D.
arranging the addict-led support group for promoting recovery because
It's the word prevention that's throwing me off.
Well, all
remember-
3 of them have prevention.
yeah,
It's
everybody
primary
has.
prevention, secondary prevention, tertiary prevention.
Mm.
So
I
what do
would
we?
say C.
I think it's C too.
Okay,
I
what's
feel like
okay? What's A?
secondary,
Secondary.
Secondary.
Yeah.
What's B?
primary.
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 And what's D?
That's second.
No.
Second.
Would it be no?
Primary?
See, that's why I was stuck between C and D, but
Yeah.
I'm leaning more towards the C.
I know
Because-
it's because they have it, so we're trying to help manage it.
Great. C's the correct answer. I'm just trying to help you figure out what the other ones
Why?
are.
That's the answer.
So
Yeah.
why wouldn't D be primary?
Because it says nothing about substance abuse. It's
I
not.
don't know. Is it because all right, so it's in the answer it says they're trying to help we're helping
Role
parents with the
model
coping
coping
mechanism.
mechanisms for what, though?
Yeah, that's what I'm trying to figure out. I just see
To
the coping
adapt with
mechanism.
coping. Adapt.
Adaptive coping mechanisms.
I see a coping
Casual.
mechanism, so I'm thinking that it's tertiary because now we're trying to help manage something because we're talking about the coping mechanism.
Unless that's primary.
And then
'Cause you're trying to
adaptive
teach
cope. Why
them
would we want to
to-
cope with it? I don't
But
know.
I don't think that's primary because how are you preventing
No.
something? They have to have something for in order for you to prevent. I mean, to adapt. I mean,
Well,
teach.
D
All right,
know it's not
Professor Marvel, help
secondary.
us out here. We
Yeah,
struggling.
we're
D,
stuck.
D doesn't indicate. I'm letting you guys all talk. I'm trying to get a word in. I can't.
Okay.
Okay, you got the floor now.
Thanks. Does D indicate that there are any problems like C does?
Mm-mm.
Not
No, that's-
definitively.
Exactly.
So it
So
would be
you're
primary.
just generally trying to help parents role model coping mechanisms.
Okay. It's not specific to.
Exactly. C is specific. It talks about somebody in recovery, so you know they have something. Right?
Mm.
All right, go to 7.
Which nursing intervention reflects maleficence?
Non-maleficence. Okay.
Which nursing intervention reflects non-maleficence? Thank you. A, obtaining a new urinary.
Malfeasance. Malfeasance.
Malfeasance.
Yeah, that doesn't say malfeasance though. But I got you. Okay, so which nursing
should
intervention
say
reflects non-malfeasance? A, obtaining a new urinary catheter kit after contaminating the sterile field. B, inserting a feeding tube to administer meds in a client who swallows normally. C, failing to document observed side effects to administered medications. Or D, maintaining confidentiality of a fellow nurse who is working under the influence.
Ooh.
Mm.
What does non-malfeasance mean?
You
Do
know,
Do
harm?
no harm.
Do no harm.
So I want to say 2 because they gave him medication in a feeding. No.
but they say they swallow normally, so why would
They
you?
swallow
Yeah,
use
why would
normally.
you
feeding
give a tube to somebody that swallows normally?
Mm-hmm.
It says non-malfeasance. Non-malfeasance.
Non-documenting side effects to administer because if they had any kind of a side effect on medication and they didn't annotate it, the following nurses that come on board don't know about it, nor the doctor.
But that is
So if they
still
give
doing
them a-
harm if
if they
they
give
don't
it-
So
document.
that is
So,
doing
so if
maleficence.
malfeasance is doing harm, then non-malfeasance is not doing harm.
Oh, non.
One of
Why is
these
it not one?
Not doing harm.
It's one.
So would it be maintaining confidence? Oh, never mind.
Mm-mm.
Never mind. I read
I
the
think
whole
it's
thing.
A.
I think it's
A
A.
then. It's A.
Yeah.
Yeah.
Do no harm. Right. If you have contaminated a cath field and you don't switch out your kit, are you potentially doing harm? Yeah.
Oh, if you contaminate it, yeah.
Yeah. Well, that's what it says. Obtaining a new urinary catheter kit after contaminating the sterile field.
That's doing no harm.
That's doing no harm. You getting a new kit is trying to minimize the harm. Where if you look at C, that's more of do good. So that's your beneficence, right? Failure to document is doing no, it's good versus harm, where the sterile field is potential harm. That makes sense?
It does.
Okay, 8.
Wait, what was 7? I'm sorry. So we did say
A.
A, right?
A.
Yeah, A. Definitely A.
All right.
Okay, 8.
The hospice nurse notes the client's pain is poorly controlled despite a fentanyl patch and as needed sublingual morphine. Which intervention is appropriate? A, add non-pharmacological pain management to avoid the risk of addiction. I like that one. Notify healthcare provider of the need for additional pain management. Absolutely not. C, counsel the client and family that a pain-free death should not be expected. Or D, oh, hospice nurse. D,
That's why I was
remove,
saying hospice. I say A. I say
remove the
the
fentanyl patch
notify the
early and
provider.
apply a fresh one in the same location. You would never put a fentanyl patch in the same location normally.
Yeah, I say B
Yeah, I would get them more
because
pain meds.
it's the minute you said hospice in the
Yeah,
question,
D.
I went for B.
Yeah, we want them to be comfortable. So
Right.
yeah,
Why is A wrong?
because why would we want to not give them medicine
I mean, they're in
to
hospice
avoid
be in
care.
addiction?
pain.
They're
They're
in
dying.
hospice. They're in
They're
hospice
dying.
care. Yeah, they're actively dying, and it's
Yeah,
ad-
addiction
we
is not
care
an
what are they
about
issue.
going to get
addiction?
addicted to?
Yeah,
Exactly.
like they're dying. We want them to be
Right.
comfortable.
Why is C wrong?
That,
Pain
because
free.
that's not
Because it's not
true.
realistic.
It's totally not realistic.
Yeah, you heard me laughing when she read that.
Yeah. And why is D wrong?
Oh, because
never
of the
put-
whole location thing. You
Yeah.
can't put a
Right. You don't
fentanyl
put a
patch in the
fentanyl
same
patch
spot.
over another fentanyl patch, right?
Yeah, you can't do
Yeah.
that.
Right.
Mm-mm.
Okay. Number 9.
The client tells the hospice nurse that I do not
Wait, hold
understand.
on, wait a minute. What was it? What was the
B.
answer?
B.
It's B.
B.
Okay.
Number 8 was B. What's number 9?
The client tells the hospice nurse that I do not understand why God is punishing me.
Hmm.
Which response is appropriate?
Needs to
A,
be-
let me pray with you for forgiveness. Do you have
Oh my
Sorry.
God.
Sorry. I'm sorry.
Go ahead.
do you have a pastor I can I'm sorry. I'm so sorry. This is so immature of me. Do you have a pastor I can call for you? Can somebody please?
C,
Somebody
dying
else
is
read
just a
C and
normal
D.
part of life, not punishment. And D, what makes you think you're being punished?
Oh my God.
Let's first think here. Let's first think
Therapeutic
here.
communication,
Exactly.
D.
What are we
Yeah,
trying to
ask a
provide here?
question. Ask a question. Why do
open-ended.
you think? Why? Yeah. Why do you
What is
think?
what is the first step in therapeutic communication?
Acknowledging their
Acknowledging it.
Exactly. Exactly. So why is A wrong?
That's just
because you're assuming that they did something wrong that they need forgiveness
Exactly.
for. Like, what are you, God?
Right.
yeah.
Um,
You're assuming. You never assume.
right. What about C? Why is C wrong?
You're just
that
because
you're
you're
putting your
just
beliefs on somebody else.
Exactly. Right. And then what about D?
That's an open-ended question. Like you're giving
Okay.
their fear back to them and asking them to expound
Mhm.
on it.
Okay. But before that, okay, what about the pastor?
Oh,
I thought it
do
would
we
be
know
D,
what
though.
religion they are? And that's not necessarily
it
like you
matter?
need more information. Yeah, no, it doesn't.
It doesn't matter. If this is an end of life issue and that's a question they're asking you, is there somebody in the religious sector that can come and talk with them? That's a pretty heavy that's a pretty heavy question for us.
Yeah, because you're assuming
Do you
one
know
that
the
they
right
have a
answer,
pastor.
or is there a right answer? And is that best to left to a pastor or whomever, a spiritual advisor for them to talk with about that?
Yeah,
Kind of out of our scope, right?
it is.
So it would be D.
So
Yep.
no, it'd be B.
B is a
Wait.
boy.
Wait,
B is in
what?
boy, right? Do
Why
you
would
have
it
a
be
past?
D?
Huh?
why wouldn't
Oh,
it be
I thought-
D?
I thought
D
we
makes
were
more
getting
sense.
them to expound on it.
Yeah, I
asking
thought we
open-
always ask for open-ended questions, like, tell me more.
Right, but
They're on hospice, so you want them to feel comfortable and relax. So you call
Exactly.
somebody they're familiar with to come in, and it's usually their pastor. Their
I
Gotcha.
feel like that's one of those questions that's gonna be
yes,
like,
that's kind of a tough one, but
I got
do
it.
they do you really want them, if they feel like they're being punished, do you really want them expounding on why they feel like they're being punished?
Yeah. A pastor would put
Exactly.
their mind at ease. And
Exactly.
if they say, can you bless me, and so I can be forgiven, they can do that where we can't.
Exactly.
I feel like this is gonna be that question you're gonna have to fix.
Nope. Nope, it's not. Trust me, I already
Okay.
checked. I already checked.
Gotcha.
I already checked.
All right, number 10, a client with metastatic cancer has made the decision to stop all cancer therapies. Which statement by the nurse reflects a respect for the client's autonomy? A, would you like my help in sharing this decision with your family? That sounds good. B, let me see if the physician can talk to you about the benefits of radiation. Nope.
Mm-mm.
C, do you think this is the best decision to make with regard to your family? Nope. D, I've heard the new chemotherapy treatments are not as awful.
Mm-mm.
I think that's
think
an
it's A.
obvious
I say it's
A.
A.
A is correct.
Oh, I was gonna say
I mean, if
that.
we say B, C, or D, we're just ignoring,
Not
You're
yeah, we're not
invalidating their
acknowledging what
decision.
they're
we're invalidating their decision,
yeah.
right?
Yeah.
So,
All
no,
right, just so we
I'm not
crystal
having to
clear,
give back any points on this. I already know the right answer.
number 1 is B, number 2 is A, number 3 is C, number 4 is A, number 5 is C, number 6 is C, number 7 is A, number 8 is B, number 9 is B, and number 10 is A. All hearts and minds are clear. Submit your quiz.
Did you get a 10, Danny?
I didn't submit it yet.
They were all right. I got a 10.
10 out of
Yes,
10.
10
Yeah,
out of
they're
10.
all right. Yep.
I
10
do
out
have
of
a 10 out of
So let me
10.
ask a
Yes.
question. Let me ask
Yes,
an
ma'am.
honest question.
I need to look
If we
at
were
you.
to do this quiz at the beginning of class and you did it on your own without any discussion, how would you guys have done?
I'd have got
I
2
would have
wrong.
failed.
I would have got one
I would have got
wrong.
2 of them wrong.
I
I
would've
think
got
I
the
would have
one with
gotten
the
2 of them
pastor.
wrong also.
I would have got the one wrong with the pastor.
Because if
I
I
don't
slow
know.
down and take my time and look at what the ask is, I'm
Mhm.
okay.
And
But
those
2 of them,
keywords.
2 of them didn't make sense to me, so I would have got those wrong.
The
Same.
keywords throw me sometimes.
There's a lot of classes this term, not so much in community, that are doing the quizzes at the beginning of class, just to check on preparation.
Oh, well,
Um,
thank you. You don't do that to us.
Yeah, no, I mean, there's a purpose why I like to wait. Well, I mean, it's all part of, we really want the students to be prepared to come when they come to class. And I don't know.
It actually helps me doing it this way, to be
Yeah, I like the
honest,
way we all
because
think through it and talk through it.
exactly.
I like that.
I get to hear everybody's rationale at the same time I'm
Mhm.
Yeah.
thinking and giving input because
Mhm.
somebody might not know something that I didn't quite catch up on,
Right.
you know.
And it sort of like solidifies that thinking like a nurse. You know what I mean? Like you can look at something and say, hey, this is the right answer. But when you reiterate, well, why is it the right answer? Or why aren't these the right answers? Or why are these the wrong answers? It makes
Mhm.
you think and it puts it all together. So I appreciate it, Professor Marvel.
I like the discussion. That's why I like to do it at the end, because number one, did you learn anything? Paying attention, and I just much prefer a participatory and engaged class. And I think
Same.
this brings that too. So,
I agree.
anybody else get below a 10?
I did. I guess I hit the wrong answer for number. What number was it?
I did the same thing. I thought I changed it and it wasn't changed.
Yeah, I think when I hit my space, like my down key, to actually like scroll down a page, it actually
Oh
scrolled
yeah,
down the
it changes
answer.
your answer
It
when you
does
do
do
that.
that.
It
Yeah.
changes your
Yeah, it
answer when
does.
you tap.
It's happened to me several times too.
What am I gonna do with you guys?
So,
All right,
Miss
well that
Marvel,
what?
am I getting back on this Zoom?
Yeah, but not for half an hour.
Yes, I know. I just wanted to make sure.
Yes, you're getting back on this Zoom. Yeah. All right, well that's it for me. Did you guys learn lots of stuff today? We covered a lot of
Yes.
topics.
Yes.
Yeah.
This is
You went over some stuff
Yes,
too
we
that
did.
I wasn't quite sure of, and
Okay.
I got it now. So
Good. Well,
This is
you
good.
guys know where to reach me if you need me. Again, I'm still open to exam reviews. And I hope you guys have a good rest of the week. Oh,
Thank you.
don't forget don't forget.
Thank you.
Wait, there's a section of your,
Oh, of the HESI thing that we can fill out
yes,
today.
you can fill out, there's one whole section you can fill out. What is it?
It's vulnerable populations.
You can fill out the
Um,
last 5 boxes of the vulnerable
yeah.
populations.
The mental illness.
And then there was the there was a whole section on what?
And then
There's
there's
like-
a whole health
on-
maintenance. Wait,
Hang on, it was on page 4. Hang on.
health promotion. We can fill out some of that.
Yep, I mean, you're getting close. I mean, if you guys are filling this out due diligently, hang on. Here it is. You fill
Health
out the last
promotion.
page, vulnerable populations. Oh, on the second to last page, you can fill out the
Oh,
home
home
health
health.
section.
We can fill out home health as well.
By the
With the
time I
hospice and
finish filling
palliative
all this
care.
out, it's gonna go from 7 pages to like
Yeah, but guess what,
10, 12 with
Miranda?
all the
You're gonna
information.
you're gonna only have one document to pull out to study for HESI. I know it's a big document, but I promise you it will help you in the end.
Mine isn't that big. I don't have that many pages.
Yeah, the original, well, mine is already at 7 because I added so much.
Well, I mean, don't overdo it either.
Yeah.
Okay, just keep it simple. I want you to know what each one is. Think of the nursing process. If it's a condition, how would somebody present to you? What would you treat them with? Okay, so don't make this complicated. Think
Mhm.
of studying for HESI. I want to know what anthrax is. What is it? What might they present with? How is it treated?
Okay.
Absolutely.
Ebola, what is it? What might they present with? How is it treated?
Hematologic. Bleed out their eye.
Okay,
Yeah, bleeding out everywhere.
good to see everybody today. Have a good rest of the week and you reach out if you need anything, okay?
Okay, thank you for everything.
Will do.
Thank
All right,
you.
you're
Okay,
welcome.
thank you.
Thank you.
You're
Have a good
welcome.
day.
Bye.
Thank you. Bye-bye.
I just want